of, what is wrong with the effeminate boy or the very masculine acting tomboy girl. There is
Hmm.
nothing to not celebrate about them. They
Yeah.
are wonderful human beings who need to flourish. And to say
Yeah.
that, oh, you're wrong. I mean, you're damaged because you're
Yes.
an effeminate boy. So we're going to fix that for you. We're
And
going
that's,
to, and I mean, how
yeah.
cruel that is to the child to be told that they're flawed so badly that they need medicine and surgery, when what it
Yeah.
is really is that they're struggling to be accepted during a really quagmire time of their life,
Yeah.
which everyone goes through. I mean, I
Yeah.
always refer to middle school as a cesspool of emotional dysfunction for the best of kids. And then you take
Hmm.
the kids that are on the margin who might be, on the autism spectrum and awkward or have physical disabilities or, somehow be outcast in their own
Yeah.
minds for reasons that are actually bona fide, as opposed to just not liking themselves,
Yeah.
which is what every 12, 13, or 14-year-old is. At some
Yeah.
point in time, they just don't like themselves at all. They don't know where they're going. They don't know
Hmm.
why and what they can do about it, and they're afraid and they're miserable, and they want to be something else.
Hello, everyone. Thank you again for joining us today. Here with Quentin Van Meter, who is on the board of the American College of Pediatrics. And he's been an endocrinologist for how many years now?
44 years.
44. It's a long time.
Yeah, seems like yesterday.
um, and if I recall one of your colleagues telling me that you studied under John Money or with John Money at some
I
point.
did when I was a fellow in pediatric endocrinology at Johns Hopkins from 1978 to 1980. He was on the faculty, and he frequently it came into our presence to give impromptu lectures to be as offensive as humanly possible to the sort of faith-filled religious female fellows amongst us. He had a real penchant to really try to make their lives very uncomfortable. That was one of his favorite things to do.
Wow. What, like, why?
He was a very odd and I would say perverted man who was really unhappy. He came to Johns Hopkins because of the draw of finding kids who were so-called intersex, kids that were born with ambiguous genitalia, and he wanted to play around with them and see what he could do in terms of changing their identities, if you will, from one sexual identity to another sexual identity. He worked with adult patients doing the same thing, and he actually could not get any cooperation with the adult endocrine division at Hopkins, and so we, as pediatric endocrine fellows, had to interface with his adult transsexual patients, as they were called back then. And it was a motley lot of individuals. There weren't a lot of them, but they were really sort of caricatures of females who were biologically male. And it was, we got into situations where I was actually sent to the federal penitentiary in Baltimore to examine one of the male patients that John Money had advised be medically castrated with Depo-Provera, which was what we used to. In those days, we didn't have puberty blockers, and if we had kids with precocious puberty, we treated them with Depo-Provera, which is, of course, Planned Parenthood's out of the box simple thing for birth control. It's a shot you get every 3 or 4 months, and so that's what was used to stop the pituitary from stimulating the gonads and producing the male hormones. And it was not done in clinical trials. This was just John Money's idea. Hey, if it works for kids, let's do it on adults and see how they do for sex offenders. And the phone rang one afternoon, and I happened to be the fellow on call, and he said, "Hi, this is Dr. Money. I need you to go to the penitentiary and examine this male patient who's having tingling of his breasts. And you need to go and find out what's really going on." Well, nothing was going on. The guy just wanted to talk. And he was in on 16 counts of rape, and it was one of those circumstances where you don't feel comfortable with what's going on. And money also screwed up any number of patients, including one of mine. I mean, would literally have had a normal, anatomically future healthy little baby boy. He would have had the genitals cut off and tried to raise the baby as a girl, just because he had a theory and it didn't really pan out. We were doing medicine, he was doing theories, and the little boy responded very well to our therapy and would have been, absolutely ruined by this procedure. So he was dangerous. He was offensive. He sort of had ideas off the cuff that he came to us one afternoon with a theory. He didn't have any slides made up because that took time and expense. It wasn't a PowerPoint in those days. It was actually, you develop a slide, then you'd have to make a gel of it, and then it was a process that took several weeks. And so he came in with a legal pad and a pencil, and he sort of said to all of us as fellows, I have a theory that people who have amputations of their limbs actually pre-plan that in most cases so that they can lose their limb and masturbate their stump as a sexual object. And I looked at him, and he was busily drawing a stump of a leg with ejaculate coming out the end of it, and the poor female fellows were just, I mean, they were trying to look away and trying to just, get out of the room if they possibly could. And I said, well, Dr. Mendy, I trained at the Naval Hospital in Oakland, and, our 8th floor with half pediatrics, half of the patients from the prosthetics research lab. All the people coming back from the Vietnam theater who had limb, mangled and stuff, who had amputations, they all came through and they developed prosthetics for these patients. And, they had really in-depth psychological evaluation of each of the patients. And there was nothing like that at all. That wasn't even an option to even consider, or was it discovered or discussed. He said, oh, well, never mind. And he took his pencil and pad and walked out of the room. That's the kind of person we were dealing with. And, it was like, do we really have to do this? Do we have to have money come and evaluate our patients, or stick his nose in under our tent? Because it stinks. He was really bad.
I just have to ask, did anybody know why he was permitted to just be such a miserable person? Why was he given free reign to just come in and be like, hey, let's start doing some crazy stuff?
He published some books that were thought to be really on the forefront of human sexuality. As it turns out, he and Kinsey were doing the same kind of shallow work that had nothing to do with science and everything to do with personal bias. But it brought Hopkins, revenue. I mean, he published his books underneath the Hopkins imprimatur, and they had a sense of positive notoriety for his work until it fell on its face, and then all of a sudden they said, "Oh goodness." Along comes Professor Paul McHugh to take over the psychiatry division. And he takes one look at what Money's been up to and says, "Out the door, buddy. We're closing your program immediately." Well, not immediately, but over the course of several years, they actually did a follow-up study on the adult patients and found out there was no improvement in mental health whatsoever. So McHugh said, that ends immediately. We're not doing this anymore. And then the Raymer twins both died as a result of directly and indirectly from John Money's intervention. And that was a big scab on the surface for Johns Hopkins to have to deal with. So they just sort of said, oh, well, we won't talk about him. That was a sad era. We're done. We made a mistake. In 2017, they brought Money back out of the dregs and said he's the co-founder, father of all transgender health. We were the cutting edge. We're so glad that we have a transgender clinic at Hopkins, and we're so proud. And I'm thinking, no, it's the same process. You just dressed it up in current times with ideologies that, again, are perverse, not based on science, and hurting people.
Man, that guy, What a piece of work.
Yeah.
I've read, unfortunately, too many of those accounts and about the boys who were mutilated and made to live as girls and all of those things. Not just the Reimer twins were victims of his, but also other children. And just it was sickening, but I had to read it just to know, to get that education for myself and to spread that awareness and talk about this, because it is so disturbing. These experiments are done on children before they ever get to experience life as their sex. It's crazy. I saw one activist saying that, oh, well, your gender identity is actually cemented by the time you're 3 or 4. How? You haven't had time to live as either gender yet. Really? Like,
the old adage was that by 18 months, a toddler probably has had their hands around their genital structures to know what's there and what's not there. They don't verbalize that, but they're sort of busy with their hands, and some of it might be some mild masturbatory effort on their part, which is age appropriate and just curiosity. And if it feels good, rinse and repeat and do it again. And so there is a sense that there is a knowledge of that, but it's not cemented necessarily. We always said, in terms of our trying to solve the problem of a child born with ambiguous genitalia, is to figure out what's the reproductive function of that individual, and what is the sexual function of that individual going to be with the anatomy that if they don't have it and it can't be constructed, what is the best outcome for this patient? And those decisions were made as a team. Money gave input to that, but he was really pushing to say, well, let's get this done, get the surgery done, and ask questions later. There was no informed consent. There was no protocol. There was no institutional review board setting up a protocol for this is how you proceed, and these are the safety things, and this is, research today is guarded by the Protection for Human Subjects, and you have an independent organization looking at the informed consent process and the protocol design. You have additionally an independent safety committee, which has, there's no financial crossover, no interest in that. The safety committee is independent entirely of the investigators and the institution, and they look for signals of harm. And they're called adverse events, and then they're called serious adverse events when it involves a hospitalization or a death. And those must be reported within 24 hours, and the safety committee has the power to stop the protocol in its tracks if anybody dies as a result of the intervention, whatever it is. And so it's very surprising that the NIH allowed their conglomerate study that's ongoing with the 4 centers, Los Angeles, San Francisco, Boston, and Chicago, who are have patients that are being followed in their NIH grant-funded protocol to observe what's going on in the transgender clinics and come out with ongoing assessment of their mental health. That 2 patients killed themselves and 7 additional had suicidal ideation in these protocols. And so if you had a true safety committee, they would have said, all of this has got to stop, signal to each of these institutions to cease immediately until we can pull back, evaluate whether or not the deaths were related to what was going on with the interventions, and if so, cease and desist moving forward. None of that has happened. They actually reported in the New England Journal of Medicine last year how successful this protocol was. Never mind the 2 deaths and the suicidal ideation and the others. We are on the right track. We have proven the mental health improvements, and gosh, aren't we happy? And this is in what was touted, has been touted, is probably the most prestigious medical journal on the planet. And they wrote that, and the editors allowed it to be published. And it's like, wait a minute, what has taken over these organizations and these journals and these academic institutions to look past that?
Yeah. I think that's the question we're all asking. Is it money? Is it some kind of ideation? And why would that have corrupted so many people?
It's a little bit of a power grab in academia. And if you can get your name on papers, you basically get grants. And grants are what run the research. And federal grants essentially do so much to fund the research in the clinical teaching departments. And if you have more papers published, you're higher up on the list to be able to get a decent amount of funding, or whatever you want, and then you get other doors opening for you. So there's that, and then there's just the egotistical nature of the individuals who are very, very narcissistic individuals who love to see their names in publications and at meetings, and and love to be swarmed with fans who say, "Oh, wow, you're doing so much good. You're an expert in this field," and whatever. So what we're trying to do is just save the lives of children, behind the scenes.
Yeah. Do you think that it is that kind of egotistical attitude, that false confidence, of that bravado that money had, that lended to his, I guess I would say, success with his peers, of like being able to be like, oh, I'm just so contradictory. I'm so sure of myself. I must know something that you don't.
No, that would describe money to a T. He was, he loved the celebrity of what he was doing, and he was the darling of the sexual revolution. And then, that there you go. That was big in the 60s and 70s, just like Kinsey.
Yeah.
And it's like, if you look into what these men actually did, it's so perverted and so awful and so dishonest, intellectually dishonest, that it should never have seen the light of day. But, in their time, they were, highly celebrated individuals for most of their lives.
Yeah. I've been looking into the sexual revolution, and it basically just seems like a bunch of perverts realized that they could tell everybody else, hey, you can be perverts and it'll make you happy. And people believed them.
It basically gave you permission to do things which you, in your core of your being, knew were probably immoral. If you have a moral compass, if it's a non-religious moral compass, if you want to think of it that way, or if you are a devoutly religious human being who lived by the precepts of your faith, you were to be laughed at. We're going to make you uncomfortable. We are so sick and tired of being, proselytized to and preached at, and you can't touch us. We've got you on this one. We're gonna open up this Pandora's box and just we're gonna have so much fun watching you squirm. Literally, money loved to watch people squirm.
Would you say that the sexual revolution is kind of like where all of this tinkering with hormones like really took off? Because we do see things like the birth control pill starting to be like mainstream and things like that around the same time.
Yeah. So, that again, that's an issue where it was sort of open-ended. It was a quick answer. It was touted to be sort of, well, that will be the end of abortions, sort of sold as this is a way for, and it unlinked marriage and sex. It really did that. It's just, and that actually was a pathway to uncontested divorces as well. It follows and it follows, and it sort of, we're unraveling the nuclear family in any way we possibly can. And that's, somewhere behind the scenes is this sort of continuum from the late 1800s, in Europe, the Frankfurt School, passing Marxism along the way, trying to rear its head in various and sundry iterations throughout the 20th century, and still pervasive today in so many devious ways through, what looks like, social justice and whatnot. And what it is, hey, what we really want to do is to take down the family, make it go away, get rid of religious faith, have one faith, and that is in your governmental agencies who will basically tell you what you can and cannot do. You're not in charge, and so you give up those rights.
Definitely.
And that's, you say, oh, conspiracy theory, tinfoil hat stuff. No, it's this when you actually get people to step outside the box and speak honestly. They have a bone to pick with a faith-based, family-based society, and they see it as an impediment to their long-term strategies. And so what can we do to pick at it and make it crumble and fall on its knees? This is, these are sort of a string of things that help that along.
I think part of that might come from, some religious families were, extreme or bad or whatever. But I think also another part of it is, like we've seen with the doctors and things like that, or the people behind the scenes, power grab. Because if you destabilize the family unit, the most foundational structure for anybody, then what's left? Who's going to take care of you? Oh, well, the state, and we'll just tell you what to do. And we have all the answers. And now they have all the power and the loyalty.
And the funding and they can direct, they can grab onto your children in the schools and keep the parents out of the loop. The thought of a school inviting in a drag queen to be anywhere near a child is beyond the pale. I mean, it's, first of all, it's so offensive to women. The drag queens are just, they're such caricatures of what a woman is supposed to be, and so disrespectful thereof. And so how do if feminists look at that and say, that's, hey, we're going to squash you like a bug. We're a very powerful lobbying or group. We're going to stand up and be against you, doing what you do for your sort of theatrical preference. So I don't really have any respect for, the drag queens. I mean, people can do what they want in their own little personal space, but when they begin adversely affecting the lives of individuals who they're exposing their ideas to, they have to be called to question, and held responsible, and they're celebrated. This is it's like, how did we get here? I mean, this is just, we keep getting these sort of explosions of insanity, and you think, no. I mean, I always think of my poor father-in-law who passed away in 1995. A career naval officer, and absolutely his integrity was to his bone. He ethics that were just a model to see a human being. And I think he would probably die of fright if he had the ability to come back and see the world, because it's just disgusting.
Yeah, it was always supposed to be adult entertainment and meant to be kind of like a specific, like, niche thing. And now it's become this mainstream thing. And I guess people were sympathetic initially because, like with the transgender thing, it has a narrative of, I was oppressed and this makes me feel powerful and good about myself. And people can relate to that. And that's, I think, the most insidious thing about this is they take people's insecurities and appeal to them and say, you can relate to me. I can relate to you. And so that's why you just have to let me do whatever I want. And it's like,
why would I ever do you any harm? I am the emperor. And I'm in my new clothes, and you will, we just go along with this. And, God forbid you should question, because I'm the expert and you're not. And I'm in a position to heal, and you're broken, and I'm going to heal you. And, come over and be happy for the first time in your life for about 10 minutes or a year, maybe. And then don't come back to me when and blame me, for God's sake, for what I've recommended and done to you. I mean, the detransitioners' stories are just heartbreaking. And we're going to hear more and more and more of those things, because there's some brave individuals out there who have hated themselves for so long, thought that transing was the right thing to do, and realize they still hate themselves and probably are far more embarrassed and self-loathing than they were before they considered going through the medical and surgical interventions. And, it takes incredible courage to stand up and say, I did wrong. It was my choice. It's an adult kind of, pulling your arm and saying, come this way, it'll be fine. You're only 15. You don't need your breasts, That's the tragedy when I think there's legal recourse. If an adult consents, supposedly they understand everything, but there are adults who fully agree that they were never ever given full informed consent about what to expect, and they started this detransitioner tsunami that's coming, and the others are coming along.
Yeah, I have a lot of friends who are detransitioners, and I admire them so much because I can't imagine, like, not only were they harmed this way, but now they speak about it and they just get so much vitriol back at them. And it's incredible that they have been able to find the fortitude to keep pushing and be able to trust anybody ever again. Like, they're incredible people, and I'm so grateful for their friendship.
Just the vicious nature of it. Chloe Cole, who has sort of been the first and forefront, young lady who went through transition, met surgically, was at a rally with, and I can't remember the specific individual who was with her on a college camp. Oh, it was Billboard Chris, and I don't know that you know who he is, but he's just a crusader who is so vibrant and fun to listen to and to be with. He was wearing his billboards, and Chloe was with him, and they were about 350 antagonistic protesters, one of whom was a drag queen with giant breasts, who came and flaunted them in front of Chloe's face and said, "Eat your heart out, baby."
Oh my God.
I mean, that to the bone is so insanely cruel. But
Chloe's the oppressor there, clearly. Chloe and Chris, they're just the two of them. They're oppressing all of those people.
Yeah.
They're, clearly the ones that are being mean and horrible and everything else.
Yeah. Well, there's an old adage that, if somebody comes after you claiming things, it's usually they're telling you did what they are actually doing instead. Yeah. They're guilty of what they claim you're doing that you're actually not doing. And so they take their own self-hostility and throw it at you, especially when they're dead wrong.
Exactly.
The more they are in the wrong side of the issue, the more vitriolic and horrible things happen back. So,
yes, they do tend to be pretty nasty. But to get to more of your expertise, I have quite a few questions because I have a lot of discourse with activists online because I enjoy it, kind of. It helps me develop my arguments when they sometimes they'll really throw something out of left field and I'm like, wow, I hadn't heard it worded that way, so I'm going to go ahead and see how we can argue against this. But one thing I hear all the time is, well, we use puberty blockers for precocious puberty. And they're fine. That's all fine. We don't see any issues with women who went through precocious puberty and were on puberty blockers. And I looked into those studies, and they're actually really lacking, in my experience, in like the side effects and things like that. They're mostly just focused on fertility retention,
yes,
and height, and that's it.
Yeah. Those are the two issues. Are the reason you use them in youngsters is to preserve height when that becomes an issue. And some of these kids are uber tall, and so they're tall because they started early, but they also have a potential to be a very fine adult height if left entirely alone. The problem is that it's really socially awkward particularly for, and these are predominantly females, for them to be menstruating in first and second grade. That's just it creates a social circumstance that is very, very awkward. So, there's the social issues and there's the height preservation issues that help us govern whether or not we recommend this as an option for the girls and the boys who have true precocious puberty. There aren't very many of. We see a lot because that's in our wheelhouse. But precocious puberty is rare. It really is rare, truly. There are a lot of things that look like puberty that aren't. that get called precocious puberty. Puberty is not happening any earlier today than it was in 1960 when and so menstrual periods in females, on an average, if you're Caucasian, it's 12 and a half. If you're African American or Hispanic, it's 12 years of age. That's been there. That's been there. It hasn't moved. It hasn't budged. But we're told that puberty is getting earlier and earlier. It's being blamed on food additives and hormones and chemicals and stuff. Just to be contrary and to basically ruin industries and to point fingers and blame. So the real truth is it is rare, but we have this tool which every single family that I deal with, I say this is an option, and I'm not mandating this. I'm putting this on a table. There have been reports of emotional turmoil really cranking up in some of the cases, in some of the kids. It's not common, but I don't want you to go into this blindly. There have not been birth defects or infertility any greater than the general population in a study group that's been followed for about 30 years. Now, that's not very many patients. I mean, we're talking about they're maybe 30 plus, and they keep they keep disappearing because they're out of the loop, and the company that is doing the follow up can't find where they've gone, and that happens in studies. But we know we can recommend this as a safe thing in terms of not creating infertility in the long run, which is the key issue. And so, having said that, we're going to warn you that there might be, if your child is prone to anxiety, this intervention, it's only going to be for a short period of time. We're not talking about doing this indefinitely. As a matter of fact, what we're going to try to do is to pull the plug on the suppression of puberty at a time so that your child can enter puberty along with their age-matched peers, so that they're not really outside the box in regard to onset of menstruation. And so it's a timing thing where we often, the average age, I would say, for females that we see in our practice is age 7. Okay, because anything that we're getting these referrals of the girls that are truly in puberty. We find they are truly in puberty before their 8th birthday, and say this is the circumstance. Your child's height is either going to be in trouble or not, and we would expect that your child is going to be menstruating about this age or not, and how do you feel and what do you feel comfortable with letting things go, and we just monitor, and there's nature takes its course, or doing a temporary interruption of this for a very calculated time, and knowing that we are not interrupting the physiologic timing of puberty in adolescence when the body is expecting to have all the organ systems respond to the hormones that are assigned biologically to that body. That if you're a male, you're going to have certain responses to testosterone and estrogen. If you're female, likewise, and they're different in males and females. The pulsatile activity of the hypothalamic secretion of the natural hormones that create the pubertal move are essential for brain growth, and they published a study in the endocrine journal, the Journal of Endocrinology and Clinical Metabolism, that said, hey, we've discovered that there are problems with early dementia in patients who don't have this change in adolescence and of the cycling of the natural hormones that induce puberty. How critical it is for that pulsatile action to occur to avoid early dementia. So, I mean, bingo, right there. You say, oh my God. So when not to block it. It's okay when they're little for a little while, but to start them at age 10 or 9 or 8 and keep that suppression, and then on top of that throw in the cross-sex hormones, which just add on to the suppression, and to keep doing that it's an open-ended experiment, and we already have evidence this is not good for the human body.
I read somewhere that I wish I had the study with me. I meant to, and then I forgot to bring it with me. It was saying something that kids who were put on blockers for precocious puberty had lower IQs than kids who were not put on puberty blockers.
It's not really a clean study. It's an all sort of a retrospective review, and so there's no baseline testing of intellectual function, which you
Okay.
really need to do. So, I mean, I would trust
Hmm.
that as you could bias that against it, or as well as you could bias it for it, saying, "See, we did a study and there's no difference." Well, what was your study? Well, did some chart reviews. How do you find age matched controls? How do you find
Hmm.
kids that are blinded to getting this intervention with a placebo? Okay, that's what you
Yeah.
need to do, is to literally follow. And it's a study that would never be ethically approved by an institutional review board. If you know that there are cases in nature where this is an issue, uh,
Hmm.
and there's harm to be done, then it's unethical to do a study like that. And that's why there will be no ongoing longitudinal study of puberty blockers and their safety, because sterility is an outcome. And
Yeah.
I'm sorry, but you alter fertility unquestionably, not necessarily totally irreversibly, but you've interrupted the process of gonadal maturation. And what that does, we don't know what that does to the,
Yeah.
are we inducing production of spermatozoa and oocytes that are damaged, that are going to
Hmm.
be prone to miscarriage or birth defects or malignancies? I mean, we have no idea.
Yeah. I think unfortunately we're going to be finding out in the next few decades.
Yeah.
Um, and I am very sorry that we're going to be finding out. And I think a lot of other people should be very sorry about that too. But unfortunately, that's what's happening.
Well, and
Um,
the people responsible for this experimentation will be, long gone, retired, maybe not alive,
yeah,
and then nothing is going to happen to them.
that's the thing is a lot of the people pushing this have like no horse in this race. Like they're just they can just wash their hands of it, move on, forget they ever said or did some things and whatever. And meanwhile, they're just pushing people towards the ledge and they
Yeah,
don't see it.
yeah.
They don't think about these lives. Like these are real lives with real consequences. And it's very confusing to me coming from a group of people that seem to care so much about, oh, quality of life, and these people are so depressed and so this and so that. And it's like, did you think through any of the stuff you're doing? Because, everything has a cost. You can't just do everything and not think about that.
Yeah.
So it's very concerning. So I wanted to ask you, I saw today that WPATH membership is down by 60%. And I know that you I saw you speaking about WPATH and its practices. And I wonder if you could cover that for our viewers because they didn't get to see your speech on that.
So WPATH started out as the Harry Benjamin Society, and that was in honor, if you will, of Harry Benjamin, who was one of John Money's associates, and he had transitioned adults medically and recommended them to surgeons around the world to do the sort of destructive anatomical changes that took perfectly healthy body parts and took them apart. And so I think it was in the early 90s, and I don't want to be quoted on this, but they just decided that they would rename themselves as the World Professional Association of Transgender Health. World is an appropriate term because they really, the Harry Benjamin Society sort of was an international, clearinghouse, if you will, for people to, contact. There was no internet at the time. To say, hey, I think I want to have surgery. I'm an adult and I want to find a doctor who can give me hormones. Where do I go? And well, they had a network of places to go in the United States where you could get hormones here, surgery there, and that was their purpose. It was a clearinghouse, an interest group. I mean, a real significant. We're the people that recommend this, and we can get you where you need to go. So putting the name, World Professional Association of Transgender Health would sort of essentially give the impression that this was a scientifically based organization of certified, trained physicians who offered certification in the field, uh, and that this, that they were using science to put together their clinical recommendations. They bypassed all of that, and you can basically become a member of WPATH if you pay their dues. That's all that's required. And so you don't have to have a degree. You can be a high school dropout and become a member of WPATH. You can be a PhD biochemist and become a member of WPATH. And it's just, if you're interested in this field and you want to promote our guidelines, come on in and join, and we'll be glad to have you. And they have meetings and they do training sessions of this is our mantra. These are what we tell you to do. This is why you should do it. And this is how you should do it. And these are roadblocks. For instance, insurance doesn't cover this. So you learn to lie and, miscode around the idea and use a drug that's less expensive than the pediatric puberty blockers. It's the same drug, but it's FDA approved for adults for different indications. You can get that one at, cost. And here's how you do a GoFundMe to get your, people to send you money so you can get your puberty blockers. And, this is what they quote train you as, this is the mechanism, and mixed in there are the people who, did the research in the Netherlands. I mean, they're there. All of the directors of the transgender clinics in the United States are members of WPATH, and they are within that organization. There's starting to be a schism, if you will, of those who say, we maybe should not be making this recommendation. There are potential harms. And so I think the organization is beginning to weaken from within. But it certainly is not, the fact that they put together their recommendations not based on science, those are not standards of care. They call them standards of care. Courts and judges and attorneys say, oh, well, these are the standards of care. Why are you against the worldwide acceptance of these things? And we answer back, they are not. These are the opinions of people based on anecdotal surveys and things like that. So no, there is not really science behind it. So that's WPATH, and I didn't know they were dwindling in membership, but that's a good sign.
Yeah.
If they're lacking in science, maybe their luster is a bit less, and they'll be less effective at recruiting people. And I think they'll be held accountable legally. They are actually under the gun legally. They're being sued for their recommendations, and I think that's point as many cannons at that as you can. Just like the American Academy of Pediatrics has come under fire for their position statement that they wrote in 2018, written by a resident in pediatrics. He wasn't even out of a training program, and he was the sole author and kind of took some human rights campaign guidelines that had been laying around, and he put them together and said this is the scientifically strong basis for intervening, and this is what you should do. They're being sued, and that doctor who wrote those are being sued, and it's appropriate that they should be sued by a detransitioner because harm came to them based on what these people wrote and published as the most up-to-date recommendations.
Wow. You made me think of a good question kind of on the fly. So you said, you're being puberty blocked and you're being given cross-sex hormones at the same time. That would probably cause a little bit of turmoil, I would think, in the body, because you're suppressing like the natural processes and the natural balancing that takes place in the body, along with like flooding it with exogenous hormones. So,
well, there are natural disease states where hormone levels are where they shouldn't be. They're elevated, and these have been well known for a century as clinical entities. And then finally, when they figured out how hormones worked, exactly what the mechanism of harm was, women who are exposed from their own body to excessive amounts of testosterone-like hormones called androgens, and men who are exposed to excessive amounts of estrogens. Okay, so we know what the outcomes of those are, and what the recommendations for treating these kids are. They have guidelines from the Endocrine Society on one hand that says no woman should ever have a testosterone level raised greater than 100 nanograms per DL if you're going to intervene with supplemental testosterone for postmenopausal depression, never raise the level above 100, period. On the other hand, the Endocrine Society guidelines for transgender health suggest that these girls should have testosterone levels raised to 1,000. Same organization, one recommendation for adult women in terms of testosterone supplements, and the other for, I mean, you can't make this stuff up.
Yeah.
And so we know the harms. We've got heart disease, strokes, cancers. It's out there. It's all out there for everyone to see. And they're busy trying to invent, papers and getting them published. Like the minute that they're going in, they're right up there in the front of the journal, saying, "Oh, this is safe. This is all safe."
Mm-hmm.
We've looked at testosterone in females assigned at birth, which just, I mean, makes you want your blood boil. You're thinking of that. Like that's where you get your sex from, is what's assigned to you at birth.
Yeah.
As opposed to where you are biologically at the moment of conception. So, there's just nonsense happening. And I think the thing that will really bring this to its knees are all the legal recourse that's going to be taken against all the people that are doing this actively to kids. And, that's, I hate to say it, but, when in a long conversation with Dr. McHugh, that was his first thing. He said, this is how it will end, is by lawsuits. And lo and behold, here we are on that pathway.
Yeah.
So,
well, thankfully it is coming to an end in a lot of places. I wish it was faster, but what can you do? So I wanted to talk to you about puberty blockers and executive function. So if you could first explain what executive function is.
So executive function comes from the development of the frontal lobe of the brain. Okay, it's sort of the clearinghouse of of what makes sense, what risk taking and consequences, and also it governs how learning pathways work. So if you facilitate executive function, you facilitate the ability for the child to do well in school. That's why some of the medications that are sort of thrown at the kids with the diagnosis of attention deficit disorder, which is another quagmire of an issue. But executive function can improve with the use of some neurostimulants. And so, the wiring of the brain is very active. Things are being taken down and things are being reprogrammed all the way through adolescence. And when you stop that process, it's inevitable you are going to mess up where the child was, going to be going intellectually and in terms of their intellectual competencies. And you don't have a control to say, okay, I'm going to treat half of you with a puberty blocker and let the other half of you go through puberty. And then let's do some IQ testing and, neuropsychological evaluation of the pathways of learning, which are convoluted and amazing. And see which, whether or not the half that was treated, because everyone's an individual. I mean, there's just no real way to do this. And so, but if you know that you're messing with the wiring, you're really playing with fire. I mean, it's just, there's no reason to do that, especially because there's no benefit. And that's the key. If there were a profound benefit from this, and you'd say it's like a cancer drug, you're going to die of cancer if we don't dive in and give you a medication that's going to make you infertile, but you'll be alive. There is clearly, absolutely, utterly no evidence that there's any improvement in mental health in the vast population of people who have been trans or who've had puberty blockers. None whatsoever. Now, there is also some concern that when you look at the data and tease it out, there's actually worsening of mental health. But, that's a sort of a slippery slope you can go down, and they could say, well, what are you basing that on? Poorly done studies. And the answer is, because we don't have studies. That we can really say controlled studies. We're doing a retrospective review, just like you guys did to make your case. And so it's the same argument. We'll stay away from that. What we do know, we can unequivocally say, is there is no improvement in mental health. And what we do know also is that kids who've been blocked, had their puberty blocked, and combination of that and cross-sex hormones, they may not be suicidal, but the number of medications they take to to settle their ill mental health rises precipitously when they have puberty block and sex hormones. They may look stable, like the ocean is calm on the surface, but beneath there is a ton of turmoil going on, which requires more and more and more medication to solve the mental health issues and keep them stable. And that we know for sure. That's an unquestionable finding in these kids with puberty blockers. So we're just, you can extrapolate and say, well, why would we even take the risk? If we know how critical it is that the building of the brain and the wiring, the rewiring, the unwiring, the rewiring is all happening during adolescence up to, the brain is very plastic up to age 25 and probably a little beyond. Why would you want to interrupt that when you can't regain that?
Yeah.
Take it back and undo what you've done.
Yeah. It is really alarming how people forget that kids and adolescents are just in flux for so long. Like there's so much development going on. A 10-year-old and a 14-year-old are like worlds apart from one another. And it's
as a 21-year-old or a 25-year-old.
Exactly. And so it's really bizarre that people are just like, nah, they're all the same. Just go ahead and throw the kitchen sink at it.
Sure.
And instead of trying to guide these kids and help them accept themselves, we're taking these bright kids who might be like an outlier socially or something like that, and medicalizing them simply because they don't fit in.
Yeah.
And it's really tragic to see that, and very perverted that it's being done in the name of kindness. It does not make sense to me. I would really like to see children celebrated for their differences and accepted, as opposed to
the whole concept of what is wrong with the effeminate boy or the very masculine acting tomboy girl. There is nothing to not celebrate about them. They are wonderful human beings who need to flourish, and to say that you're wrong. I mean, you're damaged because you're an effeminate boy. So we're going to fix that for you. And I mean, how cruel that is to the child to be told that they're inherently they're flawed so badly that they need medicine and surgery, when what it is really is that they're struggling to be accepted during a really quagmire time of their life, which everyone goes through. I mean, I always refer to middle school as a cesspool of emotional dysfunction for the best of kids, and then you take the kids that are on the margin, who might be on the autism spectrum and awkward, or have physical disabilities, or somehow be outcast in their own minds for reasons that are actually bona fide, as opposed to just not liking themselves.
Yeah,
which is what every 14-year-old is at some point in time. They just don't like themselves at all. They don't know where they're going. They don't know why and what they can do about it, and they're afraid, and they're miserable, and they want to be something else.
Yeah. Well, it's a big change. Suddenly your interests totally change. Suddenly you're not just some little kid wanting to play with toys. Now you have all these weird urges, and you have all these like thoughts and emotions, and it's just so tumultuous. Yeah. And it really is like that time, like in the chrysalis between caterpillar and butterfly, and the whole thing's just like breaking down and being reconstructed, and then somehow you come out the other end and mostly just forget about it. You're like, that was weird anyway.
I'm okay. I got to not worry so much about the shape of my nose. It's okay.
Yeah,
it's okay.
It's like, it's the best time though to have a bad like haircut or something, because then it's like excusable. It's like, I was like 14, so it makes sense.
Yeah, I got my curly perm when I was 14, and I was like an experiment. My hair grew out, and thank God, my mom told me not to do it, and I said I had to do it, and I did it. It's done.
Yes. Yeah, those changes are that's time for those kinds of changes, not permanent ones, because nobody's ready at that age to make permanent changes. So going back to the precocious puberty, I have questions about that, because you did say that it is a pause button for children who are very young, and that you put them on it for a certain amount of time. Can you elaborate on what you mean by pause button? Because your body's still going through changes, and it's still growing.
Well,
but
there is
something's going
a
on.
background degree of growth, okay? But there is nothing sort of revolutionary going on at that point in time in terms of growth. Everything has not really been exposed consistently to hormones of puberty. That we sort of see this bubbling up and we catch it as soon as we can. And by doing so, we're not, that's not a time of life when there's a lot of anatomical change. There's not a lot going on in any organ system that it's not exponential in any possible way. So to just take that and shut that down for a year or two, and the purpose is not to let the child supposedly make a decision about where they want to go, such as they always talk about, the puberty blockers are just a pause button, so that they can sit back and reflect in their counseling and decide whether or not this is really what they want to do. That is absolute BS. They get on the puberty blockers, and the first thing they want to do is to appear to be in puberty like their peers are, but for looking like the opposite sex puberty instead. So the Dutch study had a long time. It was puberty blockers maybe by the age of 12 or 13 when they'd already been in puberty for literally a couple of years. Stop it then, and then 3 to 5 years later, consider cross-sex hormones. In the U.S. transgender clinics, it's start puberty blockers, and within 6 to 12 months, you're on cross-sex hormones. And 98% of kids on puberty blockers do the cross-sex hormones. 98%. And they're proud of that statistic. They've actually published and saying, look at this, there's been no regret. There's no such thing as regret. That's all manufactured by wacko right-wing transphobes. Everybody's happy, you see, because why would you go forward if 98% of the people go forward? That means that they're happy and they made the right choice. But it's this, when they say it's just a pause, you want to just basically punch their lights out because it's such a blatant lie. Okay. When they say they're going to kill themselves if they don't get this is life-saving care. You want to punch their lights out because it's a blatant lie. I mean, I'm not violent in any way, but I mean, you just want to say, how on God's green earth can you as a scientist even open your mouth and utter such travesty? It is just an outright bald-faced lie, and you are using that as a sledgehammer to force these kids into something which they will regret inevitably. I mean, it's, if somebody's made a really god-awful mistake as an adult and they say, it's my fault, I did it, I'm just going to have to live with the consequences, and they happen to be not so miserable with their medical circumstances, that when they answer a survey, are you happy with what you did? Sure. Yeah, I'm happy. Well, let's tease that out. Okay. I think, Kenneth Zucker, who is the sort of the godfather of gender identity disorder, as it was called then, said every one of these adults needs lifelong mental health care. Now, if they persist through adolescence into adulthood, and that's the direction they go, they're probably not going to be, they're going to scream and kick until they get their transition. So when you do that, if that's the choice that they take, you do not let them loose. You insist that they continue mental health counseling for the balance of their lives, because, the lifespan of adult transgender individuals was reported to be half that of the standard population.
Yeah. It's always very sad to see.
Yeah.
And I think that's very true, that a lot of them do still need a lot of mental health services. Like with any kind of mental health disorder that causes delusions and things like that. Also, fundamentally, it's a lie. So I think that really...
they're escaping from something that really has eaten them up inside, to the point where they say, I can't be who I was scheduled to be. I've got to run away from it. I have got to hide somewhere. I have got to get that boogeyman to not be part of my life. And I'll do it by changing from a man to a woman or a woman to a man. And that'll do it. That'll help me escape. And a lot of the times the things that they're running from are all related to traumatic experiences, including being sexually abused as a child. I mean, there's about a 60% chance that an individual who is transing has had some form of sexual abuse.
Yeah.
So, when you put that statistic on the table, oh my God, you have hit a nerve, and they're saying, all right, you're saying that all these people are are perverts, and you're not listening to what I said.
Yeah.
These kids don't do this for a reason just because they are actually, you can't be born in the wrong body. That's it. That's just science. So if they're trying to be in a different body, there is a reason why.
Yeah.
And I love it. Walt Heyer, who is one of the octogenarians of detransitioners, says when people come to me and they ask for help, or they're questioning me, I ask them this very simple question: why did you not want to be the sex you were born? What happened to make you not want to be the man you were supposed to be, or the woman that you were supposed to be? What happened?
Mm-hmm.
He says they get taken aback, and they makes them think, and then all of a sudden it makes sense to them. Well, why didn't we work on the trauma that led you to not want to be who you are, and to convince you that you could be something that you're not? And let's work on that. Let's work on that. That's where you need help. Now that you're where you are, God bless you. It's where you are, and we're going to pick up the pieces, and we're going to get you to be the most healed person we possibly can, given your circumstances.
I have spoken to a lot of trans-identified people because of my own struggles with gender dysphoria, and people I like and people I don't like, people who were activists and people who aren't. And honestly, it just always comes back to self-loathing and feeling like you were wrong for a myriad of reasons, and then blaming it on your sex and blaming that you didn't fit it on it. And for me and for them, like, as we've talked about it really does, like, when you start asking these fundamental questions like that, it really does start to melt away a lot of that delusional thinking, like, oh, it was meant to be. I always felt this way. It's a fundamental part of me. I was born with that feeling. And then, no, it all starts to fall away because we realize it was something informed by family, or it was something informed by the way we saw men or women being treated in culture, or what have you. And sometimes there is abuse, and sometimes there are comorbidities and things like that. It's crazy, like, how many of us have things like OCD or ADHD or autism or something. And I'm honestly, like, starting to wonder if, like, some of it is caused by OCD and, like, obsessive thinking and stuff like that.
There's no question that to come to the conclusion that you are something you're not comes from a fear. I mean, an undercurrent mental health discomfort that's so intense that you're looking for how the hell do I get out of this?
Mm-hmm.
And you go to a counselor who may be a counselor that's just not suited to you, and you think, well, I've been to counseling and my anxiety is still here. It didn't help. I don't think counseling is the answer, because that happens. I mean, there are therapists that just aren't good fits. Some of them are terrible therapists for everybody. Some are dynamic and perfect for certain individuals and the wrong fit for others. You have to be so careful about seeking the help and not thinking that because you don't feel better immediately that it's not a mental health issue. I mean, this is all about mental health. I mean, there is no biologic basis at any aspect of it whatsoever, other than perhaps a tendency for personality to be, this way or that way. And that's for, I mean, there's, having a gene that says you have maybe a 30% greater likelihood of becoming an alcoholic as an adult, doesn't mean that you have to be an alcoholic. You can say
that's a good point.
That's the background there. But there are things that I do to either fall down that canyon or to just realize the canyon's there and I'm never going down in there. Yeah. And so you take everything that that you can and say, I need help, and I want to be a whole person, and I want to be happy. Let's make that the goal. Don't all the other stuff, directions you're going, things you're thinking about, is all window dressing. And this is such bad window dressing because it just tears the snot out of a normal, healthy body and makes it damaged, unquestionably damaged, where it wouldn't have been if you had just focused on the mental health and the wellness of that child. So when I hear that there are experts who are focused, I'm an expert on gender, mental health, come to my transgender clinic and, we'll work on this together. That's just somebody who just says rubber stamps, the guidelines, and you come in and one size fits all. Oh no, but it's very individualized, you see. I mean, I hear that over and over again. Every kid is totally assessed individually and thoroughly evaluated. No, they're not.
Yeah.
They're just put on
So as an endocrinologist, do you know that, as you said, it is damaging for the body, and we can't really do studies because of that? Like, they can't really be approved because of the nature of the damage that they can do. So, why is it allowed if we can't do these studies and it's known to be so damaging?
Because it got slipped into academia, and celebrated. And the fear that if you don't go along with this, you're a bad person. I mean, you are to be chastised. You will be kicked out of an academic department. You will not allowed to be published in any journals. We will use our network of, because it's like you're being a racist. Okay. And we don't allow that on our faculty. We are a faculty of, pure heart and, and goodness. We are not haters. And so shame on you, for even considering this. And that is such a powerful weapon to yield. And this is at a time where, being phobic about anything and just calling somebody a phobe of any kind is like, oh no, you can't. Oh, no, that's not me. That's not me. Okay, all right. I'll let you. I won't do this, but I'll look the other way. And that's what's happening in academia. So it's a nucleus of very, very angry, people in power who are saying, I am going to make you squirm like a bug because I'm not happy with myself for whatever reason. And, I've never felt happy truly, but I am in a position where I can make your life absolutely miserable. I can publish and you can't. Ha ha ha. Okay. So I'm already got one leg up on you. I can present at meetings. You can't. I'll make sure you can't. I've got the people who are designing the meeting, and I'm going to tell them you are not to be considered as a speaker. You're awful. Wow. You're terrible. And so, we can't get into the educational forums that allow us to have a dialogue. So there's no dialogue on purpose. The only reason you would squash dialogue is if you were afraid of it.
Yes.
Period. I'm not afraid to talk.
So who's phobic?
Yeah. And so, let science be science. That's what science is. It's a constant reevaluation, a challenge, a hypothesis, a theory, a proof, and mistakes have been made in science, and so we've only moved forward to better things because we let the questions be asked. We questioned frontal lobotomies and said, no, there's way more harm. And so that got tossed out, and with good reason. There's no such things as repressed memories. Okay. That's Paul McHugh's first great triumph, was to get rid of that, because that was a quagmire mess of nonsense, which had parents jailed and family, and the kids were having a party getting their parents in trouble, and loved it. Okay. Like the Salem witch trials. I mean, it's just, all these things historically where you can get and wag the dog by the tail if you're given that tail to hold on to and given permission to do so. This is where we are with this. And it's incredible that it's happened. And all we're asking for is a platform and a dialogue. And if you shine light on this sucker, everything will just disappear in turn, because it's not based on any science whatsoever.
Yeah. Is this medicine, would you say?
There are a lot of places in medicine where, I've been practicing medicine as a general pediatrician and a pediatric endocrinologist overall for let's see, let me think my residency. That's about 47 years total. And I have seen stuff happen where influences by new drugs that wanted to be introduced and that replaced old drugs that were perfectly wonderful but unfortunately very cheap.
Mm-hmm.
New things would come in and I'd say, oh man, this is unnecessary, but it just kind of got into the mix and it got accepted and then became a standard of care and the cost came down eventually. But other things that were less expensive were very effective and had less side effects. And if you knew how to use them. So it's like the art of medicine is disappearing and we're into sort of a protocol, rubber stamp kind of a thing, which to me is a sad thing. It's what we should be doing as physicians is, not just, practicing cold fact, but mix it together with empathy for the patient and an eye on morality. I mean, that's everything is falling apart because we're being shamed for following some sort of moral compass.
That's true. I think so.
I'm thinking, well, your lack of a moral compass is its own religion. Okay,
that's true.
Secular
Yeah,
relativism is a religion, if you will, and you're imposing that on us through government regulation and shaming people who are practicing their faith according to the doctrines of their faith and having a moral center and calling it, oh, you can't do that. You're being judgmental. Well, calling me a transphobe is being quite judgmental, I would say.
Yes.
Because there's nothing, I'm not an anti-trans person. Well, no, I'm so pro these kids saving their lives and from damage that I'm one of the most pro-trans individuals on the planet, and yet I am painted as anti-trans, which to me is name calling and is phobic. So
yeah,
it works two ways.
It definitely does.
So,
so going back to the studies about precocious puberty, I'm sorry I keep asking about this so much. I've just seen this argument thrown around so much, so I want to try and have all the information I can. Were there any studies done on the prolonged bone health or the organ development, and about how long are these kids put on blockers for precocious puberty?
So the average length of time is probably 2 years. Okay. There's some outriders on that. If, luckily we have in our armamentarium of the puberty blockers, things that don't last a year. Okay. But that last a couple of months, where if you try it on for size and you have a really bad emotional turmoil outcome, you can say, okay, we're not going to continue beyond the period where this first treatment of the 3-month product, it'll wear off. And, we've proven that this is not a good fit for your child. But if you, have a preconceived notion that you're going to do this and not pay attention to adverse outcomes, if you're going to pay attention, then you go as long as you need to just undo this in time for them to get into puberty at the time when their body is physiologically expecting those changes. That's what you want. So blocking puberty for a prepubertal child is not going to affect their bone density because their body is not expected to start accruing calcium in the adolescent time frame because they're not in that age group. But it's very critical that in adolescence up through age 25, that you do not block their puberty, that you do not let the estrogen levels drop, because that ends up, unfortunately, blocking the ability of calcium to enter into the skeletal system. And then you can't put it in afterwards very effectively. It's the doors are closed. So what's in the bank is in the bank.
Okay.
So we know that no one argues that. No one on the other side argues that. They just say do you want brittle bones or do you want to be dead? No, we've already taken the dead part out. That there's not saving a life at all. Period. Don't even let that. If that goes by your lips, you're a charlatan and you should be shut down. So beyond that, there's a total agreement that bone density is adversely affected when you block puberty in the adolescent years. There's no evidence that when you do that in a younger child for a couple of years, that's an outcome.
So somehow then the body knows based on like your age how your bone density needs to be taken into account, like what
It's
needs to
one of the
trigger.
mysteries of human physiology is that, there are times and as a season for everything. Okay. And,
Interesting.
pulling in calcium in giant quantities is not what you need to do when you're 3, 4, 5, and 6 years old. Your systems are open. If your diet has calcium in it and you're taking in adequate vitamin D, or you make your own vitamin D with sun exposure, which is something that we're seeing. Vitamin D, is not coming into the body and helping calcium be absorbed as much because of sunscreens. We're all
Okay.
very sensitive about sunscreening everybody, and infants and toddlers and a young child. No sunburn, no UV radiation that could cause. But UV radiation is what helped the skin manufacture vitamin D for us. So this is sort of a new phenomenon over the past, say, 3 decades. And so we know those things, but it was not critical. The critical time is when your bones begin to elongate, and they need that calcium coming in. And your calcium is an ion that is necessary for chemical cellular reactions in muscles, and it affects insulin's ability to get inside cells. It's a vital ion in the body. And your body will do anything it can to keep your calcium levels up. And to do so, it borrows from the skeleton. That's where the calcium comes from when it can't come from the diet anymore. So if you deplete that banking account and it can't be borrowed from later on, you end up with osteoporosis and fractures and menopause and things like that. So we know that about the standard events that occur, and those aren't occurring. The body is not going through, a giant growth spurt in ages 4, 5, and 6. The biggest time of growth is the first year of life, and then it tapers down and settles down for a while until puberty comes along, and then you have a large period of growth and elongation of the long bones, which gives you your height. So stopping that at a time when that's not really what the body is expecting and isn't necessary is an okay thing to do. I mean, you weigh it, measure it. If this child is going to be tall and this child is going to menstruate in the 4th grade as opposed to the 2nd grade, I tend to just say to the parents, look, it's just best to watch and wait and not do this. There is an option, but I think your child's going to be fine, will not end up short, will be able to tolerate things socially. And there are families where the age at onset of periods is average 9 or 10. And so mom, sisters, aunties, grandmas all went through. And those families do not want to touch the puberty blockers with a 10-foot pole. We did it. We're fine. We know how to handle it.
Yeah.
Do this alone. And I say amen to that.
That was my experience in my family. So
just, that's different than, a kiddo who has no family history of that and who, is starting with breastbudding at age 6 and moving, to the point where, okay, when you're 8, you're going to start your periods and you're going to end up being quite short. Those are the kids that we recommend. You never, ever tell a parent they have to do something. You give them the option, because this is not, again, it's not a life issue. It's maybe a quality of social circumstances for a couple of years, but it's not going to end their life or make them handicapped because they entered puberty early.
Okay. So, that's so interesting. So if you're starting puberty then that early, do we know why the bones don't just start doing that whole cascade of things and growth?
They will eventually if you let it go. Okay. If you let them get in through the middle of puberty and toward, because puberty is a 6 to 7 year process from start to the end of it. And we're catching these kids in year 1. Okay. Not if they're in year 4, there's nothing you can really do for them that's really going to help them in the long run.
Okay.
So, because they're getting into that, their brains then are doing, and we really have never looked at a study of the general population of kids who experience spontaneous, uninhibited, precocious puberty to see whether or not they had any intellectual differences. Okay.
Yeah.
We know an awful lot about the kids that have what we call constitutional delay. The girls that are gymnasts and track and field sprinters and stuff, and long distance runners, that they delay menarche, the onset of periods, because they don't have enough body fat to sustain a pregnancy
Right.
and nurse a child. And so the body says, "Oh, you haven't got enough body fat. We're not going to let you have that cycle start and be able to conceive until you get some body fat on your body."
Yeah.
And so those girls sometimes are 16 and 17, and before they have their first period, and their bones are already at risk. So we really push to, if a girl hasn't started her periods by the time she's 15, we're looking for reasons that, and if there's nothing pathologic going on, we'll give them some estrogen supplements to get them, just so their bone health is okay. We know that. I mean, that's the same endocrinologists that are recommending puberty blockers are recommending estrogen supplements for girls and adolescents who are delayed.
Wow. That's
because they know it's wrong. They know their body.
Yeah, talk about hypocrisy.
Oh, yeah. And one of the most Hippocratic things I heard was an expert from Cincinnati Columbus Children's Hospital, rather, who wrote one paper saying it's unethical to put adolescent males who are severely autistic, who have unbridled libido, and they're sexually touching everybody, and they're masturbating in public, and it's absolutely abhorrent to do that ethically, to put them on a puberty blocker because they can't consent. That same author said, "Oh, block puberty in kids who want to be transgender because that's ethical. They can't consent either." So how can you write one paper and the other paper be the same person, use the same standards, which are totally at odds with each other? That's happened, and it's like you sit back and say, "Oh my God, do you not see what you're doing? Do you not see the hypocrisy in this?"
I really don't think they do. It's alarming.
I've got about 5 more minutes that I can.
Okay.
Because I can talk for 3 hours, but I've got to get someplace.
We'll just have to have you on again another time.
Okay. Happy.
But thank you so much for joining us and for answering all of my questions that I had written down here. I've been wanting to talk to you for a while since I heard about who you were, and I was so excited to see you at the conference. It's like seeing a celebrity. I was like, "Oh my gosh, there he is!"
I love that conference because there are so many phenomenal people that I'm running into that I've not known before or whose names I've heard of. To just have a chance. I mean, I love the panels that they had at the conference, and particularly the panel where we had the political left and political right on the stage, respecting each other so highly, and agreeing so strongly on the core issues on this.
Yes.
It's just like, there's hope in this world. There really is.
It warmed my heart. I'm coming from the left. Like I moved over. Well, they left me behind, and then I had to go and find out all this information that I had been lied to for years. But so then it was really warming to me to see all that, like, cooperation and getting along. And I'm more of a traditional, like, liberal. I love seeing that. And I've always been very patriotic. My family immigrated from Cuba. I love America, and I love this, that we can be different and yet agree on things and cooperate. That's amazing.
Yeah.
But yeah, I love that I got to meet you and that you graced us with your presence and were so patient answering all these questions so professionally. So thank you so much for joining us.
Well, happy to do it, and we can do this again sometime. I'm happy to have a longer conversation. Okay.
All right.